On this computer. Okay. So, of course, what's due today is this is week 8 out of 10, Wednesday, September 23rd, 6 p.m. MED210, that's Anatomy and Physiology 2. And I'm Dr. Garais for Stratford University. And task 7 items are, of course, due. Task 7, lesson 7, and discussion 7 due today or tonight, or in actuality, tomorrow morning, because I'll deal with it. I'll deal with it tomorrow morning. But tonight's topic is kind of important, and what we, if those of you who went to the second lab session, we cut up a brain, and like I stated, I really wish this was the normal classroom dynamic so that we can do the lectures and the labs at the same time and not piecemeal. But it's good that those of you who already saw it, saw the brain already. And the brain and spinal cord are the central nervous system. And we call it the central nervous system not because it's in the center of our body, because they are the main part of homeostasis. And if we recall the last chapter in Anatomy and Physiology 1, we talked about ascending tracts, the brain as a kind of control and command center. And then we have descending tracts, which are motor tracts. So that is all encompassed in the central nervous system. And the messages going up and down go up and down via the spinal cord. And the brain, of course, is the centralized command and control hub. And those are the two parts. We'll also be discussing something a little bit just as important is the autonomic nervous system. And as the word auto means, it means self. So it's the self-regulation. So the items that were going to be discussed in the autonomic nervous system, you have no real control over. It becomes auto or self-managed, or like the word automatic. So let's overview. We're going to do a basic structure and function, nervous tissue. We're going to talk about the neuron, right? And the function of nervous tissue, and actually how does electricity, known as the action potential, travel? Because your brain and spinal cord, it's a mix of chemical and electrical. And that's how neurons or nerve cells communicate with each other through a series of both chemical and electrical relays. And that's why when mental health now is viewed as a chemical imbalance, and it's not viewed as, you know, it's maybe something that you get over or something that therapy can talk you out of. That's why for certain more, in my professional opinion, the more serious cases of mental disease, defect, and disorder should be not only managed through psychotherapy, you know, talking to the person, getting to the source of, you know, of their troubles, but also should be managed medically. And of course, case-to-case basis. But and it makes sense because if there's something wrong with the electrical and chemical impulses, don't you think if we know what that wrong is, we can do medication to right that wrong? Because, for example, psychosis, OSIS, abnormal condition of the mind. You can't, no matter what, if someone's psychotic, you can't talk them down. If they want to blow up the world, they're going to blow up the world. So before we can even have psychotherapy even work, we have to consider the pathophysiology of the brain. We're going to also, the central nervous system and the autonomic nervous system is part of a set of divisions, and we're going to talk about that as well. We're also going to talk about reflexes and homeostasis. Just like the autonomic nervous system, reflexes do not require the brain. They only require an ascending tract and an interneuron that doesn't involve the brain, and then descending tract. Okay. So when you look at your tasks for this week, Look at defining the central nervous system structure and function, autonomic nervous system structure and function, and you're going to see how those two are related. And what does nervous tissue have to do with it? Well, the nervous tissue is the conduit for all of these things to run. So you could easily see how they're all connected. So let's jump on board and let's talk about, let's jump to chapter 12 in our book and let's look at some pics. So I go there. And bear with us. Earlier this evening, you may have experienced some real issues with the speed of our server. Something's going on. I don't have an official word from IT, but when it takes a while like this to load, also I was doing grades and things earlier today. It took a little while. What was it? Was it chapter 10 or 12? That's how bad my memory is. Isn't that awful?
I believe it was 12.
Isn't that awful? I was just talking about it just a second ago. So when we look here, right, the central nervous system, of course, is comprised of, let's get this a little bigger. It's comprised of the brain and the spinal cord. So that's one division, okay? The brain and the spinal cord, and it's central because it's the main command and control center, and also it's the main control center of homeostasis. Now, the peripheral nervous system is everything else, right? So brain and spinal cord, right? That is central nervous system. So if I made up some word like, arm nerve or finger nerve or leg nerve, whatever other nerve would be what? The peripheral nervous system, because it's in the periphery. And it makes sense. Because if I took a machete and chopped off your arm, will you die? No, you won't. You won't be able to use the arm anymore. But as long as the brain and central nervous spinal cord are intact. But if I took that same machete and chopped you straight across the top of your head, then you'll have some significant sensory processing and motor function problems. And that's why they call it the central nervous system. So the peripheral nervous system is just everywhere else. So could I ask a question, CNS versus PNS? If I said brachial nerve, which is in your arm, right? You'd say peripheral nervous system. If I said pollicis nerve, which is the nerve for your thumb, well, that's not brain or spinal cord, hence it's the peripheral nervous system. And now you also know when we talk about diabetic nephropathies or peripheral neuropathy, that means that the diabetes is affecting where? Everything outside of the brain and spinal cord. But give diabetes a couple more years, it'll start affecting the brain and spinal cord. So let's they jumped right to. This is a brain that's recently removed, and it looks very, very different than the one we had in class. The one we had in lab was was already washed and cleaned, and you could see this still has some of its meninges, and you could see it has all these arteries and veins in it. Okay, of course. Just like we saw in lab, all the gray matter is on the outside. All the white matter is on the inside. And because of the decussation of fibers, it's the exact opposite in the spinal cord. So they jumped right into this, the neuron. I didn't want to talk about the neuron. I wanted to talk about the divisions. Here you go. Thank you. Why are they jumping all around? Okay. So in the peripheral nervous system. Okay, let's see if there's I don't like these pictures. They're confusing. There's this other picture that I used to use in another book, ANS PNS. It's better. It's simpler. Where is it? Is this it? Oh, here it is. This one's better. Let's look at this. Now, the central nervous system we already talked about, right? I've said it like 4 times already. So if this isn't on the exam, I don't know what is. But the peripheral nervous system, we already talked about the periphery, right? We have ascending fibers, which is our sensory division, and we have descending fibers, which is our motor division. We already know that from our homeostasis lecture. But what we don't know is the sensory is divided into visceral and somatic. The visceral is, if you recall from the lab, that's our guts, right? When you eat a bad street taco, you feel it, right? You feel it in your stomach, you feel it, and there's also somatic sensory. So somatic sensory is the things that you touch with your body, like your fingers, your toes. I could feel the ground underneath me. I could smell the air. You know, I could feel how cold the air is. Right? I can also see. So those are the somatic sensory is your 5 senses. The visceral sensory is your viscera, your guts. Okay. And a lot of your visceral sensory you are not privy to. Do you know exactly how much sodium you have? Well, your body knows, your viscera, your guts know. Do you know exactly how much water you're going to be putting out next time you pee? You don't know, but your body does, your viscera. So that's your viscera sensory. So that should kind of freak you out a little bit because every millisecond of your life, there is sensory coming in. And you could see if the central nervous system doesn't, and the peripheral nervous system as a whole, if it doesn't put a filter on that, just imagine if you sensed every little thing, right? If you heard every little thing, or if you felt every little thing. And a lot of mental disease and mental defect is such that they may be simply too sensitive to a lot of sensory. And we also talked about that a little bit in laboratory. I think this was the class we were talking about how autistic children have a very, very enhanced sensory and very enhanced somatic sensory. They see things and hear things that we don't because many of them don't have a filter. Now, let's look at the motor division. Of course, you have a visceral motor division. That's why when you're hungry, you hear all those horrible squirting noises in your stomach that you have absolutely no control over, right? But what you have definitely control over, your somatic motor division, right? So, you know, you have control over your hands, your feet, you can look around. Now, to an extent, your lungs, you can kind of control it, can't you? Right? So somatic will take over if I start consciously thinking about my lungs. So I can go and start breathing fast if I want, or breathe slow if I want, right? But the visceral motor will take over. Let's say, for example, if I start removing the air from the room, no matter how calm I'm going to try to be, what's going to take over? This thing right here, which is the autonomic nervous system. Sympathetic versus parasympathetic. So this is one set of things that you can draw on your concept map. And not only draw on your concept map, can you see how it's an exam? Which of the following are part of central nervous system? Which of the following are the peripheral nervous system? Which of the following are part of the sensory? Which is the following of the motor? It goes, where's the autonomic nervous system? Oh, it's part of the visceral. So if it's part of the visceral motor division, do you have any control over it? No, you don't. And that's the beauty of the autonomic nervous system. And now that I'm here, it's a great segue. I'm just going to go right into it, and I'm going to talk about it. So the autonomic nervous system is really cool because we use it in medicine a lot. I think was your lab was, no, it was the Tuesday morning lab. We talked about in Tuesday morning lab, like there's certain things you can control and certain things you can't. That's why if anyone gets a hold of this old book, I forgot the title, but it was issued by the FBI, and it had something like the 31 tells or signs of how people are lying. And you could look it up, it's there somewhere, right? And here we go. And they talked about how,
When you pay extra for a
I don't want YouTube. I just want the pictures. Here you go. Okay, this is better. So you have the autonomic nervous system, and I'm going to show you how you can diagnose drug addicts. You can diagnose liars, because remember, this is part of the visceral nervous system, the sensory the motor visceral. You cannot control it. So you have two divisions: sympathetic and parasympathetic. The sympathetic is fight or flight. So you could sit here and try to memorize all of these, but just remember fight or flight. So what happens when you're in a fight or you want to run away from that danger? Well, of course your pupils are going to dilate, because don't you want to see every punch coming, and you want to see all venues of escape? It'll inhibit anything that has to do with food, because when you're scared, are you hungry? Who go, like when you're being chased by a Pennywise the clown, do you go, hey, wait a minute, I'm in the mood for some shawarma? No, you don't think of that. And that's why you get cotton mouth when you get really, really scared. And that's also one of the signs and tells from that book. I wish I still had that book. It was so interesting because it matched up to the sympathetic and parasympathetic divisions of your body. Because you'll notice lip smacking, and they'll play around with their mouth, and they ask for some water, because if they're scared and they're lying, what's going to happen? You have inhibition of saliva. Of course, it's going to dilate the bronchi and accelerate the heart. You're running away from a pit bull. You need to run, and you need epinephrine and norepinephrine. Why? It enhances ATP. It enhances everything. Epinephrine is also known as adrenaline, and it comes from the adrenal gland, right? Of course, you're going to stimulate glucose release. You need ATP to get your muscles running, to get your heart running, to dilate your bronchi, to breathe faster, because that pit bull's catching up with you, right? Are you in the mood to pee? Nope, right? It goes, and just know that regarding sex, it's a little bit complicated, but sex requires both sympathetic and parasympathetic, but that's for another topic. But overall, I could easily ask you these things, and you don't have to memorize it. You just have to understand that sympathetic is when I'm running away from a pit bull, or when I have to go fight somebody, right? And all of these things will come into play. Like the GI will be decreased, lungs will be increased, heart will be increased, of course, epinephrine and norepinephrine, because that's what. And that's also why here, epinephrine and norepinephrine, guess what norepinephrine is related to? It's related to depression. Decreases of norepinephrine are known in the brains of the major depressive disorder patients. So if you work out, if you get excited, right, and then have a little bit of fear in your life, a little bit of excitement in your life, how can you be depressed? That's why every year, or once or twice a year, I'm afraid of heights. So every year I ride one massive roller coaster, just once, right? Or I do something stupid like jump out of an airplane, stuff like that. Right? I actually still have a coupon for some flight school in Maryland, but my wife said she would divorce me if I ever did something that insane. So she said, so I go, how about bungee jumping? I've done bungee jumping half a dozen times in my life, and I'm definitely afraid of heights.
My brother's learning how to be a race car driver.
Yeah, or I do something like that, like every once in a while on the highway, I go ridiculously fast. And what does it do? It makes me giggle a little, makes me not feel as old, makes me not feel as tired, and it's also exciting. And every once in a while in the gym, I run a little faster than I should, or I swim a little longer than I should, because get my heart pumping. And it goes. So when you're looking at that, do you see how your actions can also change your brain chemistry, your attitude, and your thought processes? Because I used to think it was kind of corny, because of course I'm from New York City. I always feel that people who are happy, bright, and shiny are idiots. But they're not. They just choose to be what? Happy.
Right.
I have some friends in the Midwest. They're and definitely from anyone from Southern California. I have a couple of classmates from Southern California. Like, hey man, everything so, and I'm just like, and then I remember the first day I met them. Well, you curse so much, man. So much negative. Oh, it's making me ill. And I'm like, go fudge yourself, right? But again, I learned over the years. You know what? They don't have it all too wrong. Um, uh, there are, because I've learned through several years of reading and of course the stuff that therapy introduced to me, that maybe I don't have all the answers. And then I started matching up the anatomy and physiology to it all, and it makes kind of sense. Now, what's this parasympathetic? If this is sympathetic, para means alongside. So it means what? The exact opposite. So the exact opposite will happen when you have parasympathetic. And parasympathetic, I think I call it feed and breed, right? Or feed in the other F word, right? So what happens when it goes when you're libidinous or you're amorous, right? Or you're hungry. Are you in any mood to go run away from something? No. So everything will be what? Slowed down. Your bronchi will constrict because you don't need that much air, right? But when you're hungry, saliva production, right? Your stomach and pancreas and intestine all what? Increase. Because what? Remember, feed and breed. You're hungry, right? Because when you eat, what are you going to do? You also urinate. Now, the funny part about sex is it requires both. But when there's too much sympathetic nervous system interaction, it's more on the parasympathetic. You need sympathetic to start it up, sex drive, but you need parasympathetic. And one classic example is erectile dysfunction. Erectile dysfunction happens a lot with people who are in high sympathetic drive, who have hypertension and a lot of stress in their life. So they can't perform, because can you perform when you're either scared or angry? You can't. So when you're stressed out, it initiates sex drive and the male erection, but it doesn't continue it. The promotion of it is parasympathetic nervous system, and that's why I call it feed and breed. And that's also when you want to diagnose some patients. You have a patient who's on cocaine, right? They've been an active cocaine user for the last 10 years. You know what? They're not gonna act like a lunatic. They're gonna act just like you and I. But what are we gonna see? Increased heart rate, increased respiratory rate. I love it. I used to have this patient, Salvatore. He used to always come to my ER. 22-year-old, 23-year-old male. He used to love methamphetamine. And Sal would be going, hey, doctors, I don't understand why they brought me in here. I go, Salvatore, you've been sitting in my ER for the last 20 minutes, relaxing, talking to nurses. Why is your standing heart rate 200 beats per minute? Why is your blood pressure 180 over 100?
Wow.
And his pupils are what? 6-7 millimeters. They're like two black beans in the middle of his eyeballs.
Oh, Jesus.
And it's the middle of it's the middle of summer, but we're in a very cold air-conditioned ER, and he's sweating bullets. And he's been in my ER for more than 30 minutes. So it's obvious what? He is still high. Because now it's a dead giveaway of his activation of the sympathetic nervous system. And what does cocaine and amphetamine derivatives play on? It plays on norepinephrine and epinephrine neurotransmitters, which are the chemicals that transmit signals into your nervous system. So that makes sense. That's why people love this drug, because it makes them happy, gives them the euphoria. And then when it goes away, they're going to need more. And that's why it's so hard to fight it, because what's funny about the brain? After a while, it won't want epinephrine and norepinephrine. It'll want the cocaine. It'll want the heroin. It'll want the methamphetamine. It won't want the normal natural high anymore. And the horrible part is it will want more every time. And that's why addiction is so hard to kick and it's so hard to fight medically. And like I said, you not only have to fight all of this medically, you have to do some psychotherapy. You have to get to the reason why this person's doing drugs, why this person is striving to be happy all the time. What is making them so sad? It's a very simplistic way to look at it, but it's according to my mother, who's been a neuropsychiatrist for 45 plus years, she said that's the one thing her psychiatric colleagues keep on forgetting. You got to talk to the patient. You have to get to the source of the problem, right? For example, a lot of patients like, oh, my mother, then get away from her. Don't ever talk to her ever again. Oh, but she's my mom. Yeah, but she's leading you to drink, or you're using her as an excuse to drink. So stop it, right? That kind of thing, right? But of course, us laypersons, not laypersons, us non-psychiatric personnel, do not challenge your patient. Leave that to the psychiatrist. Challenge therapy is very scary. It's very dangerous, and it can make your patient violent, which is no bueno. Now, let's talk about parasympathetic division. I've heard somewhere that marijuana makes you hungry, right? Well, marijuana, or tetrahydrocannabinol, which is the active ingredient of marijuana, THC, it activates the parasympathetic nervous system. And that's the reason why you want to eat, and you want to eat so much, and your heart rate is down, and everything is down, right? And you feel a little bit libidinous, you feel a little bit amorous. And you'll see they also have pseudotosis, where their eyes are drooping, right? And they have constriction of the pupils. And you see all of that, and then you look at them and go, hey, you smoking? Yeah, I'm smoking. You ever see them talk? They don't talk fast. They talk to you like that, and they giggle. And what are we talking about? But you see my boy Sal. Hey, Dr. Garais, I don't understand why the people brought me here. I don't want. He sounds like a videotape that's rewinding. I go, Sal, stop. And he goes, okay. And then he's looking at you, and you're like, he's not stopping, is he? And he used to drive my nurses nuts. Right? But then you could easily see the divisions. Next time you're hanging around people, or even in class, look around you. Look around you, especially in a bigger class. When all of this is over, look around you. And for those of you who also are on this call and also looking around, now that you have this little tidbit on how we diagnose certain people in the ER, you could use this. Look around you. You'll find a lot of high people walking around. There's a lot of people on drugs walking around. Now you'll see this word ganglia. Ganglia is just like a knot of nerves, a concentration or a knot. It's just the best way for me to put it, of nerves. So now that you know the divisions, let us now look at an actual nerve cell, the nervous tissue itself. Can't believe it is free stuff, so it's got to be a commercial. So the nerve cell is called a neuron. And here is a lovely picture, which I could do what? Do you think I could take this, erase this, and go A, B, C, D, E, F, G? Yeah.
Yeah.
Easy. So if you know that I could do that, what are you going to do with every picture that I've ever shown you? You're going to do the same. You're going to work it all out now so that come exam time, you're not guessing. Okay. So let's look at this. This is your typical nerve cell. And of course, it has a cell membrane and it has a neuron. But what's different with a nerve cell, also known as a neuron, than other cells? Well, one thing is the neuron only has a single function. Its single function is to propagate electricity in the form of what they call an action potential, or an AP, from here through its body, through this tail, and then into another nerve cell. That's its only function. So going to the bathroom, that's not its function. Eating, that's not its function. Repairing itself, that's not its function. Its only function is to propagate the action potential, or the electricity of a signal, and it does it very fast. Because remember, we have our two communication systems in our body: endocrine, which is slow but long lasting, but the nervous system is very short acting and fast. So the first thing that the electricity has to pass through is these little antennae right here called your dendrites. It goes through the body, also known as a soma, then it goes to the axon. Now, you will see here, it's colored in blue, but all nerves, if you looked at the other picture before, all nerves are colored yellow. In real life, they're not yellow. And if you recall the lab, when we looked at lab, they looked like milky white, thin threads, right? Here, microscopically, they're yellow because you see this blue stuff here. I don't know why they call it blue, but they colored it blue. This is your myelin sheath. It is made mostly out of fat. The myelin sheath gets made by this extra support cell called your oligodendrocyte. And this is very important because, remember, electricity, when it's coming through here, just like a wire, if there's no insulation, the electricity is going to go haywire, wouldn't it? Right? It'd go everywhere. But here, this forces the electricity to go down this wire, also known as a neuron or a nerve cell, very efficiently. And you'll notice there's spaces here. Those are called nodes of Ranvier. Now, what is that? Those are spaces where there is no myelin, all right? So why do we have to have this system here? Because once electricity comes through here, instead of having to go, look how slow it takes me to go through all of this, right? We want the nerve to be fast. So instead it does what? Boom, 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 boom. It jumps. And that is called saltatory conduction. S-A-L-T-A-T-O-R-Y. Saltatory conduction. And when you have a demyelination disease, right? If this myelin sheath goes away, what happens to the signal? It goes slow and will dissipate, will start going all elsewhere. So how will my patient's nervous system be? It will be a mess. If any cancer or any disease hits my oligodendrocyte, how much trouble am I in, right? How about in ALS? Amylotrophic lateral sclerosis. What happens in ALS? All this gets gummed up by all these it's not damaged. The best way to put it is like damaged cells. So if all this damaged cell is now blocking the path of my electricity, how is my patient's nervous system? It's garbage, right? Let's talk about Alzheimer's. What happens when I have neurofibrillary tangles? I tangled all of this up, right? With those neurofibrillary tangles. How am I going to remember things? How am I going to react to things? How am I going to even move around? So that Alzheimer's not only affects memory in the case of dementia, the way it kills you is little by little, it eats up all the somatic nervous system, and then it creeps into your central nervous system, and then you're done. You do die eventually of Alzheimer's. And everyone knows about the early stages, the dementia stages. No one wants to know or discuss when the patient progresses even further. And that's some real hard stuff to watch, especially those of you who have loved ones. And they don't die quick. My aunt she is in now year 11, and she hasn't spoken words for 8 years, and she hasn't made a sound in more than 3.
Wow.
And it's hard to watch. And when I'm in California, I visit her. It's very hard to watch because she used to be she's not really my aunt. She's my mother's best friend in medical school. And she, the way she found out she had Alzheimer's, she had an office practice for like 20 years in San Diego. And one day she was driving around and she couldn't remember where her office was. So she knew something was wrong. So she was driving around for like an hour going, where the hell's my office? She pulled
Wow.
over. She thank goodness she had her office on speed dial and called the office and said, call 911. I think something's wrong. And I remember coincidentally, I was in California around the time when she was diagnosed. It was just hard. And then now seeing her now, like on FaceTime and stuff like that. When my mom we still talk to her and we still sing her songs and all this stuff, hoping. But me and my mother know that she's done, because if all this gets gummed up, do we have any sensory? Nope. Do we have any brain processes? Nope. Do we have any motor? Nope. And that too. She's on mechanical ventilator for how many years now? 4. Because if Alzheimer's gums all this up, can you move? Can you breathe? Nope.
No.
There's no more control of anything. All the divisions that we talked about. Now, let me go back up here and talk about this glial cells right here. Glial cells, also known as glia. What the heck? My Mac is so sensitive. Glial cells. Remember, I told you that the neuron is the star, right?
Mm-hmm.
The only thing they do is propagate an action potential / electricity. Glial cells are the oligodendrocytes. They're everybody else who support the neuron. So there are other cells. Let's go beyond neurons, right? Let's go to glial cells. Here are there other cells like astrocytes, microglia, ependymal cells. You don't have to memorize them, but know that there are other cells that have a support function, meaning they actually feed the neuron and they actually take the neuron's garbage away. The oligodendrocyte, we have to know, also known as the Schwann cell, they perform myelination, or they cover the cell in fat, or at least the axon part in fat, so that we can have saltatory conduction, and then the electricity goes fast. We also have microglia that serve as their immune system. And remember, your spinal cord and your brain are encased in a sterile environment. The last thing you want in your spinal cord or your brain is anything from the outside world. That's why we get very nervous when I have to put a needle back there, or if I'm doing any neurosurgery, because the second I open that calvarium or your skull, that's bad news. And was this the class I told you guys that survival rates for most brain surgery is around 42, 48%?
No, you didn't
That
tell us.
half the patients will get worse.
Wow.
So when you get brain surgery, that's last chance Charlie. You're in so much trouble that we are willing to open up your brain and spinal cord to bacteria. And we give you massive amounts of steroids so that it will drop your immune system so you don't get sick. But they always do. So just know that the neuron is the star, and astrocytes, oligodendrocytes, microglia, ependymal cells, they are the support team. Okay, but you also know if you get a disease like astrocytoma, right? If you get a tumor in your support cell, how much trouble is the star, right? So no makeup for the star, no lighting for the star, right? What's going to happen to the star? The star will die. Okay, right. So this is kind of a nice representation of how your all your brain tissue and all your nervous tissue is. You have the star, and then you have everybody else around it pampering the star. Like, oh, he goes, oh, Mr. Neuron, Miss Neuron, what do you need? What can I get you? And that's what they do, because they know how important the propagation of the action potential the electrical signal is important. Now, another thing that's kind of also important is cerebrospinal fluid. It's really neat for diagnostic purposes because it's a way that I can put a needle in your back and I can see what's going on with the metabolic and the chemical reactions in your brain and your spinal cord without, totally opening up your brain and your spinal cord. And the cerebrospinal fluid comes from this choroid plexus that's within the ventricles of your brain. And the ventricles, if you recall lab, remember when we cut the brain in half and we opened it up and there were little spaces inside? Those are your ventricles, right? So like I said, whoever built us really, really perfect. But the thing is, if it's really deep inside your brain, like the choroid plexus and cerebrospinal fluid, how delicate is this stuff? It's extremely delicate. So if CSF gets in contact with the outside world or gets in contact with any drug or anything, it's very dangerous. We get very excited when certain chemicals get up into your brain, especially in your CSF. Myelin, we already talked about. It's made out of it's lipid rich, so it's fat. So if someone calls you a fathead, you say thank you and say, and he goes, yeah, I goes, I'm so smart that because I know what you said is a compliment. Right? I always thought it was interesting how when you hear insults like that, fathead and things, and you could see the myelin sheath. Doesn't it just look like a wire? And how the wire and the plastic just wraps around it. And of course, whoever built this smart because they left the space so that the electricity can jump. And when the electricity jumps, it's faster. And that's called saltatory conduction. Now, looky here. Let's now talk about what is this? This is just this is just a nice diagram about how it goes, how things go up and down. Because remember, we have, of course, sensory, right? Which is the blue, right? You turned on the faucet, you're trying to feel how hot or cold the water is. So, of course, you have sensors here in your fingertips, and then it travels all the way to the nerves. And the sensory, if you'll notice, is in the back part of the spinal cord or the dorsal part of the spinal cord. So if I break my back and then I cut only the back part of my spinal cord, what I won't be able to what? Feel. And when it goes up into your brain, right? Goes into your brain, and then it goes into the cortex, which is the main thinking part, which is up here, right? The cortex then figures out something to do, and then it tells what? The motor, which is in the red, and then the motor travels in the anterior portion or the ventral portion of your spinal cord, and then it goes down here. So if I have ventral damage in my spinal cord, I won't be able to move, right? But if I have total transection of the spinal cord, will I be able to feel anything? Nope. Will I be able to move? Nope. Right? So you could see here, this is what's going on with you right now for everything. You feel something, it goes up, your brain processes it, and then tells your motor what to do. So descending tracts, also known as ventral tracts, are motor. Ascending tracts, also known as dorsal tracts, are sensory. And you can see here, see this bump here? This is a ganglion. It's just a big lump of nerves that got knotted together. Now, remember, this is all encased in my vertebral canal, right? So remember we talked about slip discs, right? Your intervertebral disc, if it goes out and starts pinching these. So if it starts pinching the dorsal ganglion, what are you going to do? You won't be able to feel squat. And if it starts pinching the ventral or anterior ganglion, what are you going to do? You're going to feel pain. Right? So do you see now? That's called localizing signs. That's how doctors and neurologists do our job based on what my patient can or can't do, or based on what my patient is feeling, right, or not feeling, right,
Right.
I can figure out what part of the brain, what part of the nerve, and you could see here. Remember, we talked about the cortex in lab, area 3, 2, 1, and that's what? Motor. So if I put a spike through here, yeah, I could feel it, but will I be able to do anything about it? Nope. And that's actually how we found out how the brain works. Over the last, 200, 300 years, doctors have been recording all these bizarre incidences where, people got a nail through their head or, shoved their head through a plate glass window, that kind of thing. And depending on what part of the brain that got messed up, we kind of map the pathology. So those are sensory. That's easy. Now I hope they're going to talk about, because I like to talk about next, is reflexes. Oh, they're going to talk about the action potential. But let me talk about reflexes first. Let me find a reflex. Because since I'm already talking about, spinal cord. Let's talk about reflexes. And this is a pretty picture. I like this picture. It's Pinterest. You know what? How's this? I copy image. There's always more than one way to skin a cat. This is one way. This is my way of skinning the feline. Boom. There you go. Okay. So this kind of looks familiar, right? Right. We have the sensory, right? I feel something. Now, pain is one of the quickest signals, right? So you feel something, right? It goes up, right? And of course, there's one set of signal that's going to go all the way to the brain, so your brain can process it and then send the signal down. But in the case of reflexes, because of something where I'm in danger, right? It goes through the sensory, and then it goes through this green thing called an interneuron. And the green thing is only in the spinal cord. And then the interneuron sends a signal, right, to your ventral root, to the motor, to do what? Hey, that hurt. Let me get my hand out of the way. Now, do you see how the pathway is shorter than having to go all the way up to the brain, then all the way back down to the brain, back down from the brain to do something? It takes a couple milliseconds, but it's way too long. And this is the reason why, when you burn your hand, when you're frying up some pork chops and some oil gets in your hand, you pull away from the stove and then you feel the pain, don't you?
Yeah.
Because what is the true feeling of the pain is when you processed it. It took that long, but your reflexes kicked in for you to get away from the stimulus. That is what? It's called a noxious stimulus, or a stimulus that's giving me pain. And pain to us means what? Something wrong, something dangerous. I got to get out of the way. So what could I ask about reflexes? Reflexes do not require the brain. What are the parts of the reflexes? You have your sensory, or your ascending tract, right? You have your interneuron, which is located in your spinal cord. And then you have your ventral tract, which is your motor. So that's 1, 2, 3, that's all of the above. It does not require the brain. That's why in medical school, they used to always hate the word reflex medicine, because reflex medicine is like, oh, you got the sniffles? Here's some antibiotics. You're not using your brain. It goes, oh, you have an STD? Here's erythromycin. Hello, what kind of STD? Are you sure erythromycin will work? Maybe it's not an STD. But you guys see a lot of people walking around just using reflexes and not really analyzing or thinking. You guys seen that? Now, the interesting thing about this is, when you pull yourself away, I love this, because I love fear, right? So let me show you this pic. Since Halloween is coming, how many of you go to those, those haunted houses, or Uh, I love these pics. These crack me up because
Oh, I love
my,
those.
my wife doesn't want me to show our pics of we went to Field of Screams in Maryland
Oh, please
last
do.
year, and there's pics of me running over my kids to get to safety. I have one where I'm kicking the 2-year-old out of my way. It's funny as hell. But let's look at this and let's analyze this, because this says a lot about the sympathetic nervous system. You look at their face, their eyes are wide open. The pupils are, it goes, the pupils are what? Fully, they're fully dilated because I want to see whatever the danger is here. Now, not only is their face, look at the nostrils. They're flared. The mouth is wide open. These are all reflexes. You're not thinking about it because you need to do what? Get out of the way. But this kid's dead inside. I don't know what's up with him. Right? These are humans, especially this kid. And you see how they're like, because how their entire body is now moving away from the stimulus. Isn't that what happened when you get burned? Your hand doesn't only move, your whole entire body moves, because the reflexes, they're made for what? They're made for your protection.
Right.
And also, the neat thing about reflexes is they're also trained, right? If you've ever played a sport, do you start notice? Anyone here on the lecture ever played a sport? There's certain moves that you do like that because you train them so many times that if this happens, this happens. And it's so interesting because my daughter knocked my glasses out because I was just pillow fighting with her, but I'm also teaching her Thai boxing. What happened? She did 1-1-2. She did right jab, left cross. And what happened to me and my glasses? And it was automatic because because why? Because every Friday and Saturday and sometimes on Tuesday, she trains, and that's all she does, right? Very, very basic stuff, so that if someone hits her in the face, what happens, right? And if you've ever seen how a boxer slips a punch, wow, it's because of what? Training.
Right.
And but I find this picture hilarious, but mine was funnier because me, like, I was like in the back running over people, like what's it, like this.
Oh my gosh.
This girl she just was hanging off with their life. But again, you look at their faces, it's all what, right?
Yeah.
Open. Nostrils are flared. The eyes are wide open because why? Because why did? But I would me and my family, when we look at our photos, we die laughing. But last year was the worst because when I got, like I said, I love I hate what do you call it? I have a fear of heights, but I love that high feeling you get after you get scared. You know, when you get off the roller coaster, don't you feel like
Yeah.
you're $1,000,000?
Yeah.
Yeah, and then they go, we're going, my kids are like, we're going on again. And then I go, no, it's okay. I'll just gonna sit down here and tremble to death. But I feel alive. I feel awesome. Those are your endorphins. Endorphins are also your hormones like norepinephrine and epinephrine, and that's why you get that high. And that's why people like speeding, and that's why like all of my kids, they're all what do you call that? Like and my sister, they're roller coaster junkies. They're the kind of
Adrenaline
people,
jump.
yeah, they're the kind of people who like especially my son, like he'll go on the same ride like 8 times in a row, and that'll be his whole day. We'll go throughout the entire park, we'll eat and whatever, and then you come back and he's still on the same ride. And you're like, haven't you had enough?
Jeez.
Right? Oh, you know the Superman ride at Six Flags I think it's in Pennsylvania or New Jersey, one in Jersey. That thing is anything that goes 200 miles per hour straight freaking up. I left Duke there like in the morning, and I had 2 meals and came back and he was still on that line. Like, so it was like the whole day.
Wow.
And then he was looking at me like,
Wow.
he goes, he goes, I'm going to try to go 18 times today, Dad. And I'm like, oh, well, you're on crack. So just don't do that. I remember when he was a kid, he used to play with like pit bulls and stuff. And I don't know, like, but there are certain personalities who are like that. But then, but I love that natural high. And actually,
Mhm.
that's why I still work out, because there's no such thing as a bad workout. He goes, today I had a crummy workout. My gout was kicking in a little bit. My lateral epicondylitis was kicking in. I'm like, right? I can't go as fast. I can't go as far, right? And, you know, and I didn't feel it was a good workout. But you know what? When I got home, I'm in a better mood for some reason. I don't feel as crabby. And
Right.
that's cool. I think that's cool. And it's not a coincidence. Now, did any of you guys watch The Matrix, where they said, remember when they told Keanu that when Morpheus told, what was it? What Keanu Reeves' character? Neo or Neon?
Morpheus?
No, it was Morpheus
Oh
and
no, that was
Neo.
the other.
Was it Neo, right? Neo, that's his
I
name,
think Neo. Yeah.
right? Well,
I
remember
don't
he
know why I
said
thought.
something like, all we are humans to the Matrix, all we are batteries. Remember they said that?
Yeah.
Well, a battery
Yeah.
is nothing but what? Pluses and minuses, chemically, right? And we know that you
Mhm.
put pluses and minuses together, you have you put uh, um, like something like a plus and a minus together, you get a charge, right? And we all know this. Well, maybe some of you. Please don't judge me from what I'm about to say. I was one of those little kids that took a 9-volt battery, right? You know the 9-volt
Mhm.
batteries, right? Has a plus and minus.
Mhm.
I used to love putting it in my tongue.
Hmm.
I put one side, so if you put your tongue on a 9-volt battery on one side, nothing will happen.
Mhm.
If you put your the tongue on the other side, nothing will happen. What happens when you put the plus and minus in your tongue together? Bzz, you get zapped. And that is the idea and the concept of this thing called depolarization. So
Hmm.
let's, I don't like this picture. Well, yeah, let's, I always looking for my own pictures. Now, depolarization means you're doing work. Okay.
Mhm.
That's the easiest way to put it, right? And you can see here, it's electrical, right? So what does depolarization mean? Oh, here's a picture. Okay. So let's look at this meter here, right?
Mhm.
There's no electricity. There's
Right.
no electricity because all the sodiums are on one side, all the potassiums are on another side, and the pluses and minuses are what? Polarized. That means they're separated. But if I put the pluses and minuses together, right? Depolarization, what will happen? I'll get a spark.
Mhm.
Now, how does that happen in the human body? We have these voltage gated channels that move sodium and potassium and chloride and whatnot. They move them in and out of the cells on when we need them, right? So that is how you generate electricity. And that's the reason also why we still have to eat, and ATP and glucose and all of that, because guess what powers these channels to push sodium, potassium, and other ions against their gradient? ATP, adenosine
Mhm.
triphosphate, and some of them are GTP. Oh, right here, ATP, right? So now doesn't that
Yeah.
all make sense? That's why when you don't eat
Mhm.
right or you starve yourself, you get loopy, because you're not, if you don't eat, you have no glucose, and then what happens? You have no ATP, therefore you have no electricity, and your brain runs on electricity. So if it doesn't generate the
Mhm.
electricity, you get stupid. And that's why people
Hmm.
who do all-nighters, drink coffee, massive amounts of coffee, right before an exam, and then you find it very interesting. Dr. Garais, I studied so hard, why don't I remember anything? And I go, what'd you have for breakfast? Coffee and a piece of a Danish. And you're like, well, okay, because you were hypoglycemic. And if you're hypoglycemic, can you think? Right? Now, the same thing for oxygen, right? That's why fight or flight is so scary. In a fight, unless you're trained, how much are you thinking? Think about the last time all of you have been in a physical altercation. How's your brain moving? Wasn't moving very well, was it? It was all emotion, wasn't it? Right? And why? Because now you have increased oxygen load, increased oxygen demand, right? So it goes, the oxygen is being used up by other things, but not your brain. But again, like I always said, training always trumps other things. Actually, I remember CQC in the Marine Corps is called Close Quarter Combat, and the first thing they do to you, they sucker punch you, and hard, and then they tell you, remember that feeling. That feeling of confusion, and the taste of blood in your mouth, and and that dizziness. You have to remember that to fight through that, and then do what? Train to fight through that. And just like the reflexes, you can train yourself to fight through that. Now, let's make it applicable to you guys, because I'm not going to punch you in the mouth before an exam. But what can you guys do? You guys train like you fight. Do practice exams. Make up practice questions. If you don't know how, give me a call. I'll give you a whole bunch of exams, and that's what I'm doing this weekend. I'll be giving you last term's exam, right? Your exam will be a little bit different, not much, but so that you can get the idea of how to practice, right? Because if you just study, then you're not getting in the ring. You're not getting smacked around, and it goes, your brain cells won't adapt, right? And that's why there's a whole bunch of students failing the T's. You ask them, how many practice exams did you do? 1.5, and you're wondering why you failed. So,
actually, how I learn is I do practice, exams on myself after, me, I made my
make your own quizzes. And because you got to get in the ring, and you got to get in the ring regularly. But what do most students do? They try to read the chapter, they try to read my notes, watch the videos ad nauseum before the exam. Watch as many videos as I can before the exam. That's useless.
Yeah. Right? Or like a lot of other teachers would just tell you to reread the chapters, and just rereading is proven not to.
Rereading will just make you angry and make you realize how slow you read, and then make you sad.
Yeah.
That's not it. It goes, what's better? What I tell you, focused learning. Like, did we read anything thus far? We had a textbook. No, we're looking at pictures all day. Because why? Visual is much better. So if I showed you a picture of this with all the pluses and all the minuses separated, that's depolarization. Therefore, the voltmeter should be what? Negative. There's no electricity moving on. But if I have, I hope they show the other picture. If the pluses and minuses move, this is what I don't like about this. If the pluses, well, you saw that voltmeter previously, right? So if the pluses and minuses now interact just like that battery on my tongue, what happens? You have electricity. Now, what happens at the end of your axon? At the end of the axon, you'll have what they call an axon terminal. Because remember, I told you memory and thinking is not only electrical, it's chemical. So it goes electrical, chemical, electrical, chemical, electrical, chemical. And it goes really, really fast. That's why if you're on drugs or you have a depressant called alcohol, how's your reaction time? It's a lot slower, right? Actually, they've done studies. You don't even have to be drunk to get into an accident. Even half a beer will make you start slipping up.
Wow.
That's why, designated driver, just call the Uber. And why? Don't you think that alcohol, which is the depressant, can now mess with these neurotransmitters? And we already talked about two neurotransmitters, epinephrine and norepinephrine. They are all about what? The sympathetic nervous system. And also norepinephrine and dopamine have been related to depression. So guess how all of our psychiatric medication works? It works, and they look just like neurotransmitters. So the electricity, the action potential, right, comes here. Then once the electricity comes, it tells these synaptic vesicles to move towards the end of this axon terminal, and then it releases the neurotransmitter. And then the neurotransmitter goes over here, and then it propagates the signal, and then the electrical signal starts over again. This should amaze you, because this is happening in like microns, like very microseconds, right? It's very, 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 very fast, right? But now you could see, let's say this is the nerve that's signaling my depression. How about if I get a drug that will do what? Block these sites. And then there won't be a signal for depression. So do you see how psychiatric meds work? But also, this also works, memory also works the same way. That's why if you, again, back to alcohol, my favorite depressant. It's so tasty. But what happens? Because it depresses these functions so much that that's why I wasn't a blackout drunk, but there's so many good and bad times in my life because of drinking. I can't remember them. I've been to Mardi Gras twice. I have absolutely no recollection of the state of Louisiana, and I've been there twice. I only have 6 pictures for the two trips I've been down there. Because why? We started drinking on the bus. And then what happened? It depresses this function. That's why I think this is the class that I mentioned to you guys. We also have an id and a superego. Remember, the id is your natural drive, to do whatever you want. But you have your brain that tells you, no, that's against the law. No, that might hurt somebody. But what happens if I take a little bit of drugs or a little bit of alcohol? Do you not think that it will now mess with the chemistry here? And now will give me the capability of doing something that I normally wouldn't, like kill somebody or hurt somebody? My mother and I always talk about it every time we see something horrendous on TV, because we look at the history. There's a history there of they're not alcoholics, but they drank something or they took a little something right before they did the horrendous act.
Wow.
And that's the paper I want my mom to write. I'll do the chemistry, but she's like, nah, I want to go shopping for a tricycle for my kid, or do whatever retirees do. She doesn't want to work anymore. So you could see neurotransmitters, they have certain systems. You could see here, you also have a nicotinic receptor, right? Which is part of your cholinergic system. So that's why it's so hard to shake smoking. It's already part and parcel. The smoking, the chemicals that are built into that cancer stick, that tasty cancer stick, by the way, right? Is geared for what? To propagate a signal to make you feel good. And that's why smoking, every time, like for non-smokers, it's awful. But for a person like me who's an ex-smoker, I walk by, I actually even taste it. You also have, so there are some receptors that are what? Positive, right? And there are also some receptors like GABA, right? Which is gamma aminobutyric acid, or GABA for short, which are blockers. So there are things in your body that enhance the neurotransmitters in your body that also block. And GABA is really, really neat, because we have a drug that simulates GABA for seizures, which is nice. Because wouldn't it be great if I had something natural blocker like GABA blocking the massive amounts of signals that I have when my patient has a seizure? Okay. So that's what's neat about receptors. And the neat thing also about receptors is they're highly specific. Okay. Now you don't have to memorize this, but just know that some of the receptors, and you're going to talk more about this when you get into your pharmacology class when in nursing, because like I stated, that is exactly how pharmacology works. It works by receptor technology. Oh, by the way, that's also how cancer works too. Works by receptors, and the receptors are lock and key. They match each other. So if you don't want something, let's say I don't want the key to open up cancer. Can I block it? Sure. Actually, that's what we do with retrovirals. That's why HIV patients don't progress to AIDS anymore. They live for decades because what do? We have medications that block things. So that is your OpenStax, right? So let's go look at our course to see, did we talk about everything? I think we almost did. I think we're good. So let's look at, did we talk about the basic structure and function of our nervous system? Yes. Did we talk about nervous tissue, neurons in specific? Yes. We talked about the function of the nervous tissue, which is to propagate the signal, right? Also called the action potential. How do we make an action potential? Well, the ions in our bodies, the pluses and minuses. And because of ATP, the channels will pump pluses and minuses either together or away from each other, depending on what we want. If we want electricity, that's called depolarization. If we don't want electricity or we want to rest, that's called repolarization. And when I have two things that look like each other, I always say depolarization is doing work. And in order to do work, you need electricity. How do neurons communicate with each other? We now know they communicate via chemicals. Those chemicals are called neurotransmitters, and it's also the basis of modern pharmacology. We talked about reflexes and how all of this is related to homeostasis and how reflexes are to protect you against danger, okay, right? We already talked about the divisions in that lovely picture in the front. And so if we look at it, did we talk about everything? Yeah, we did. So, and that is tonight's lecture. And this weekend, look out for a practice exam. And if you don't see it by like Friday night or Saturday morning, give me a call, shoot me a text and say, hey, Dr. Garais, practice exam. And I'm like, okay, all right. But give me like.
Now, what chapter? I'm sorry, what chapters is this going to consist on? Like from 5 on, or is it going to be the whole?
No, not the whole thing.
5 on.
I'd make a 200-item exam for that. No, from week 5 onward. So 5, 6, 7, 8, 9.
Okay.
There's no week 10, right? So it's 5, 6, 7, 8, 9. And then next week, I'm going to put out a video, maybe a little video, or maybe have an extra Zoom session for those who want a little bit more specific review, because the 110 class asked for, like, they said not only a lecture, they want a full-blown review. And what's good for the goose is good for the gander. So if I'm doing it for my other classes, I'm going to do it for you guys too. All right.
Sounds good to me.
That'll be week 9.
All right.
Alrighty.
Perfect.
Did everyone register for classes? If not, shoot me an email. If you're having some trouble, shoot me an email. Check your Stratford email, because that's where the communication from the registrar and from student accounts goes. Okay? Anyone have any questions?